Hello everyone, greetings from HCG Cancer Centre Mumbai. Let us hear from our experts, colleagues, that what are the frequently asked questions about lung cancers, which are otherwise perceived to be quite aggressive and often people thought about having a dismal prognosis. So, Dr. Amrita, do you think that lung cancer and smoking are definitely related, or there's some other risk as well?
There is a definite correlation between smoking and the prevalence of lung cancer. And there are, of course, other risk factors involved as well. But smoking definitely has a causative.
So as we heard, one needs to remember that smoking is a definite cause of lung cancer. The smokers can't give this excuse that we're smoking, we will never get. That's a separate story for another day. So is there other causes? Because we see there are a lot of young generation who don't smoke. There are women who get lung cancer who never had any smoking exposure. So do you think, Dr. Dhruva, there are some other causes as well?
Yes, definitely they are. And as we all know that the poor air quality is also playing a very important role these days. And of course, the increasing trend in the younger age group with the smokeless tobacco and vapes, which should not be done because they don't have a direct correlation, but they do have some carcinogenic potential and that can cause harm in future.
So for all youngsters listening, don't vape and show your style statement. You're not doing anything great by it.
And we also have an occupational factor associated, especially in people who work in the shipping industry. So exposure to asbestos is also very important risk factor, and the common cancer that we see is mesothelioma.
Yes, so that's another comparatively rare cancer of the lungs, but yes, that's also equally important. So coming to you, Dr. Riddhi, and this is a very common question, and I know many of our listeners and viewers must be having this. Is there a way to detect lung cancer early? Is there a screening method?
Yes, so chest X-ray is a very good way of detecting lung cancers. In fact, many early lung cancers are incidentally detected on chest X-rays. There are other modalities like low-dose CT scans that can detect early lung cancers. However, how frequently to be done and which subgroup of people should undergo this kind of screening is another question. So that needs to be clarified from the government part of it. As of now in India, we don't have any lung screening program running, but as an aware individual, we should incorporate at least a chest X-ray as a part of lung cancer screening, especially for the smoker population in India.
So for high risk, yes, we can think of certain tests, but unfortunately, we don't have any nationalized program for lung cancer screening. I was reading a Twitter trend which says that people living in Delhi of 15 years or more should actually do a low-dose CT scan of the chest because of the air pollution already they are exposed to. People have tried abroad doing low-dose CT scan as a nationalized program, and they also did not turn up to something very positive. So moving from this to more of a pragmatic treatment approach, we also hear as oncologists many times, many people ask us that, what do you think, Amrita, is surgery the only curative option for lung cancer?
Surgery is definitely an option, but we of course have other options as well. Radiation therapy, especially stereotactic body radiotherapy of the lungs, is an excellent option. We also have systemic therapy, but as we have seen, recent studies have also shown that SBRT works wonders in lung cancer, especially in the early stages.
Yes, very much. So if people are not able to undergo surgery, it's not the end of the road for them. We definitely have treatment options which are equal and at times with better quality of life. So Riddhi, then if these SBRTs, which are like high dose focused radiation, can you explain them in very simple language, what our listeners should be or viewers should be knowing about it?
So SBRT, let's talk about the first word, which is stereotactic. Stereotactic is a term that refers to stereotaxis, which is defining a specific point in the space. So stereotactic radiotherapy is where we define a particular point in the space, which is essentially the tumor center, and we deliver a very precise and a high dose of radiation to that particular tumor, sparing all the surrounding structures, normal lung tissues, other structures like ribs, heart, great vessels which are in the mediastinum part of the chest, and we spare all of the surrounding structure, we spare the surrounding lungs, and we deliver a very, very high dose to the tumor. rendering the patient cancer-free essentially by killing all the tumor cells that are present inside the body.
So in simple words, we are delivering high dose to the tumor. We are sparing the normal surrounding structures. So we do the double whammy. We kill the tumor. We spare the structures of the normal structures of not undergoing any deleterious long-term side effects. So you have to do it, Durva. Do we have the technology to it? Because to my understanding, the lung is moving. So as the tumor. So do we have technology to do that?
Yes, so our radiation machines, we have incorporated what we call the fourth dimension of any tumor, which is the movement. And that's what we call as the 4D CT. That is a four-dimensional radiotherapy, where we incorporate the tumor motion and target our radiation therapy incorporating the motion. So we do that, so there is no miss.
So we can take care of this lung motion, either tracking the motion or even dampening the motion. So in medical terms, it's called tracking or gating, and then treat the tumor and minimize giving extra radiation to the lung. So for all people listening, lung cancer, any of the stage, we have a role of radiation, and the techniques have improvised over the years. We have quite precise technology with great outcome and a very good quality of life. So for all lung cancer patients and our viewers, in any stage you diagnose with lung cancer, there is a hope, there is a treatment option. That treatment option can be surgery alone, can be high dose radiation like SBRT alone, or combination of all of this with systemic therapy and immunotherapy. So it's important to treat the cancer right way first time, because that's the key for a successful outcome. Thank you.